Good day, Ma'am, Sir. I am Crystal Jade S. Busmion, your nurse student from J.H. Cirillas State College, Pagadian. I will be performing the hand washing with antiseptic for today. Inspect hands for visible soiling, breaks, or cuts. Cover skin lesions before providing care. If lesions are too large, direct patient care is restricted. Open cuts can harbor microorganisms. Soiled hands may carry microorganisms. Inspect fingernails. Fingernails must be short. Remove artificial nails, extenders, or polish. Harbor high concentration of microorganisms. Increase microbial load on hands. Push wristwatch and long uniform sleeves above the wrist. Avoid wearing rings. Complete access to fingers, hands, and wrists. Stand in front of sink, keeping hands and uniform away from the sink surface. The edge and inside of the sink are contaminated. Reaching over the sink increases the risk of touching and contamination. Turn on water with knee or foot pedal. For hand faucet, use paper towel to turn on the faucet. Discard paper towel in proper receptacle. Knee and foot pedals prevent hand contact with faucet. Faucet handles are likely to be contaminated. Avoid splashing water against uniform. Microorganisms travel and grow in moisture. Regulate flow of water so temperature is warm. Warm water removes less protective oils. Rinse hands and wrists thoroughly. Keep hands and forearms lower than elbows during washing. Hands are the most contaminated part. Water flows from least to most contaminated area. Rinsing microorganisms into the sink. Apply antiseptic soap and rub hands together vigorously, lathering thoroughly. For liquid soap, apply 3 to 5 ml. For bar soap, rub firmly between hands. Rinse bar soap before returning. Ensures hands and finger surface area are clean. Wash hands using plenty of lather and friction for at least 15 seconds. Rub hands palm to palm. Rub back of each hand with palm of other hand with fingers interlace. Rub palm to palm with fingers interlace. Rub with back of fingers to opposing palms with fingers interlock. Rub each thumb clasp in opposite hands using irrotational movement. Rub tips of fingers in opposite palm in a circular motion. Rub each wrist with opposite hand. Soap cleans by emulsifying fat and oil and lowering surface tension. Friction and rubbing mechanically loosen and remove dirt and transient bacteria. Interlacing fingers and thumbs ensures that all surfaces are cleansed. Adequate time is needed to expose skin surfaces to antimicrobial agent. Clean under fingernails with fingernails of other hands or with disposable nail cleaner. Areas under nails are often contaminated, which increases the risk of infection. Rinse hands and wrists thoroughly, keeping hands lower than elbows. Washes away dirt and microorganisms. Dry hands thoroughly from fingers to wrists and forearms with paper towel, single-use cloth, or warm air dryer. Drying from cleanest to least clean area avoids contamination, prevents chopping and roughened skin. Discard paper towel in proper receptacle, prevents transfer of microorganisms. Turn off water. For hand faucet, use clean dry paper towel. Avoid touching handles with hand. Discard paper towel in proper receptacle. Wet towels and hands allow transfer of pathogens from faucet to hands. Faucet handles are contaminated.